My name is Kieran McHugh. I'm a nurse from Ireland. And I work with the International Council of Nurses and the Nursing Now campaign. And through those third parties, we have a working relationship with the WHO. And I'd like to talk about health workforce for a second. And from what I've been hearing from CSER about reforming the services, this might tie in quite nicely. The WHO Health Workforce Department, through their regional and country offices and with collaboration of ourselves, the ICN and the Nursing Now campaign, are putting together this thing called the State of the World's Nursing Report. And I can see my WHO colleague in front of me nodding, so I'm sure she knows what I'm talking about. This report, what it does is it collects data and analyses data at a very local and country level and feeds back centrally into WHO. And it provides technical descriptions of nursing workforce globally, education, regulation, practice, standards locally, and it helps the Health Workforce Department to help deliver universal health coverage, implement the SDGs, and highlight areas for policy development over the next 5 years. And my question for the panel is, I'm sure it sounds completely fundamental that we have identified where the issues are and where to spend our money on. But I'm just wondering that when we get this money that we're talking about, that we're looking for, is there a central place that we can go to identify where is the best place to spend the money on? Where are the deficits in the health sector? And is there a kind of a report or a central database where that information lies? Thank you.
Okay, thank you. So, two quite challenging questions, I think, for the panel. I'm going to pass these straight to the panel. So one, how do we work with or against in this context in terms of the large sums of money that are within the financial interests of companies? And the other is, it's great if you get the money, but how do you know what to spend it on? Indeed, how do you equip your workforce for the future? Okay, any particular eager takers? Wow, you've stumped the panel. You've stumped the panel.
I can say something.
So this is our